Welcome back to the Fourth Trimester podcast, where we explore the postpartum experience through interdisciplinary evidence-based perspectives. This is your host, Faye, with an episode exploring the physiological changes that occur during postpartum, recovery, and return to activity. After birth, the body does not simply return to normal. It undergoes coordinated recovery across multiple organ systems. To start off with, one of the most obvious systems is the reproductive system. This in the uterus begins a process called involution, gradually shrinking back to its pre-pregnancy size, and this process takes weeks. During this time, women also experience luteal, which is the vaginal discharge that progresses through stages. To start, for the first 1 to 4 days, it's bright red and blood heavy. And then it changes to a more yellow or brown from days 5 to 9. Then it's white and mucus dominant, and this process can take up to 5 weeks postpartum. So even when somebody looks externally recovered, there's still huge ongoing processes internally for tissue healing. Then on to lactation and hormonal regulation. Colostrum is produced immediately after birth, and this is rich in proteins, immunoglobulins, and protective factors like lactoferrin. And then around day 3 or 4, lactogenesis begins as prolactin stimulates milk production. So then oxytocin is what drives the milk ejection reflex, commonly known as milk letdown. But this reflex can be inhibited by pain, anxiety, or depression. So already we can see that there's a connection here between emotional stress and physiological function. So it's not simply the physiological system on its own, everything interacts, especially emotional, psychological, and further social factors. Then the endocrine system and menstrual changes also occur. So if somebody is not breastfeeding, menstruation often returns around 6 to 8 weeks postpartum. If they are breastfeeding, then there are elevated prolactin levels, and this actually suppresses ovulation. Sometimes this can actually delay menstruation for months postpartum. However, it's important to know, though, that ovulation can occur before menstruation returns, and so this means that pregnancy is still possible during this postpartum time. Postpartum is a hormonally dynamic time, and it's not predictable, as many may assume. Then on to the cardiovascular system. Immediately after delivery, cardiac output can spike 60 to 80% due to shifts in blood volume. Within hours, it declines, and by 2 weeks, many cardiovascular measures return to pre-pregnancy levels. The heart is actually undergoing structural remodeling during pregnancy as well, and this also gradually reverses postpartum. Again, it's not a small adjustment that's happening, it's a huge systematic recalibration of the whole body. And then there's also renal and urinary changes. So some women experience urinary retention immediately postpartum, whereas others contrastly experience urinary incontinence. And this affects up to 30% of postpartum women. And then let's dive into some recovery aspects. So the majority is either a cesarean birth or a vaginal birth, and recovery is also shaped by which mode of delivery you experience. So in a qualitative study examining lived experiences of recovery, women described being discharged with strict instructions after cesarean birth. They were to avoid heavy lifting, avoid straining the abdominal muscles, avoid stretching their arms overhead, avoid driving, and avoid sexual intercourse for 4 to 6 weeks postpartum. But then once they get home, most women actually resume primary caregiving responsibilities, and so this meant they were often ignoring the instructions given to them out of necessity. So this shows that there's kind of a disconnect between medical advice and the reality that postpartum women are facing. One participant of this study reflected on her cesarean birth recovery and comparing it to her vaginal birth, and she said that the cesarean, it wasn't a particularly wonderful time. Looking back on it, I think, I survived. It took me 13 weeks to recover. I felt completely exhausted most of the time and in a lot of pain. I sat in front of the fire with a hot water bottle to my cut because I was in pain. Not feeling particularly good about anything really. I felt pretty miserable. Whereas with my second, which was a vaginal birth, I just felt completely normal. End quote. So this contrast is pretty powerful to see the experience of one woman with two different delivery modes. Another participant of this study described her recovery in this way, quote, "The physical recovery was so much longer, and I don't think you're prepared for that. You're not told that a cesarean is more painful and that you're in more pain, and it's restrictive pain. Like there's things that you just can't do. Well, things I couldn't do. The bending, the picking up, and things that are really so significant when you have a baby." End quote. What stands out in these accounts is that it's not just pain that women are experiencing, but it's this restrictive pain in their recovery. And it's a pain that interferes with fundamental caregiving movements and responsibilities of the newborn. Women also described that they had unexpected immobility, frustration with physical limitations, and then they had feelings of guilt when they violated the recovery recommendations, but they had to because they had to care for their infant. So then this also builds onto the emotional aspects, not just physiological. Many women also reported that they had conflicting advice about safe pain medication while breastfeeding. So some chose not to take any medication at all, or they took subtherapeutic doses, which increased their discomfort. This physical strain connected directly to emotional stress, and that can layer on to the emotional and psychological impacts of postpartum that we discussed in a previous episode. So while the cesarean birth is sometimes framed as a controlled or protective, these lived experiences highlight that it is major abdominal surgery layered onto the postpartum recovery. One of the common issues postpartum is pelvic floor dysfunction. There's also a belief that planned cesarean birth protects the pelvic floor. Research has shown that 35% of women report pelvic floor dysfunction after cesarean birth, which is compared to 54% after vaginal birth. So while a cesarean birth does report less pelvic floor dysfunction, it's not insignificant at all, and it's still a big issue. So pelvic floor dysfunction is related to weak supporting tissue structures, degeneration, trauma, and it can include urinary incontinence, pelvic organ prolapse, and sexual dysfunction. And it can seriously impact women's quality of life. Pregnancy itself, through different hormonal changes and the mechanical pressure of the enlarged uterus on the pelvic floor muscles, is what weakens the pelvic floor supporting structures and muscles there. And more than 1/3 of women experience urinary incontinence or prolapse postpartum. So it's definitely very prevalent, and many women do not seek treatment early. A study by Wren and colleagues found that pelvic floor muscle training can prevent or improve symptoms of pelvic floor dysfunction. And so a correct contraction of pelvic floor muscle training involves a squeeze around the pelvic openings and then followed by an inward cranial lift. It's often held for a few seconds and then relaxed and repeated. And they found that early postpartum is a critical window for this neuromuscular retraining to help improve symptoms of pelvic floor dysfunction and prevent it, although prevention does actually occur often during pregnancy as well. Another common issue is diastasis recti. So diastasis recti is the separation of the rectus abdominis muscles along the linea alba, and this affects about 60% of women at 6 weeks postpartum and around 32% at 1 year postpartum. So the linea alba is the line kind of going up your stomach, and so it's the separation of your abdominal muscles from that line there. It's often treated as an aesthetic issue, but it's also associated with reduced abdominal strength, low back pain, pelvic floor dysfunction, and pelvic girdle pain. So quite severe, significant issues along with that. Current guidelines emphasize a more conservative management as the first line of treatment, using exercises with surgical intervention being reserved for more severe cases. And so physiotherapy is considered the gold standard treatment currently. Importantly, complete closure of this gap is not necessarily required. Some research done by Skora and colleagues suggests that generating tension through the linea alba using the deep trunk muscles like the transversus abdominis is more important for function than just eliminating the separation entirely. So the deep trunk muscle activation, especially that transversus abdominis and the pelvic floor muscle coordination, combined with diaphragmatic breathing, is what's prioritized early postpartum. Now, it should also prioritize intra-abdominal pressure management, especially once returning to exercise. So, speaking of returning to exercise, this can be a really challenging and confusing process for many postpartum women. From a review by Schultz and colleagues, the general recommendation is for women to gradually return to their normal exercise routine once it is safe to do so. And women are often cleared for activity at 6 weeks, but this might be a too simplistic view because there are significant musculoskeletal changes. There's joint laxity, altered posture, there's pelvic floor trauma, as well as bone mineral density loss during pregnancy, as well as hormonal shifts, and mental health risks, such as postpartum depression and anxiety, as we discussed in an earlier episode. Furthermore, there's sleep deprivation and breastfeeding demands. So, taking into account all of these things, just clearing everyone at 6 weeks is maybe too broad of a recommendation, and it should be a bit more individualized. So furthermore, exercise recommendations actually lack a lot of specificity, they found. They found that most studies recommend 150 minutes of moderate to vigorous physical activity per week and to do gradual progression. However, few studies actually provided clear intensity, progression, or screening parameters, and less than 25% of the studies this review found gave specific aerobic or strength training details. So most of the guidance was general rather than individualized, which makes it really hard for women returning to exercise in postpartum. Overall, it does seem that the early focus in postpartum exercise should be on breath work, including the diaphragmatic breathing to engage the deep core muscles, as well as gentle pelvic floor engagement, trying to strengthen the pelvic floor muscles that experience trauma during birth, as well as deep trunk stabilization. Then progress should be gradual, so you can progress the strengthening, but you should always be monitoring symptoms like leakage, feeling of heaviness, pain, or any bulging occurring. Importantly, full anatomical restoration may not always occur, but functional strength and stability absolutely can improve. As well, exercise postpartum has many other benefits. There's improved cardiovascular fitness, improved strength, and many have found that there's a decreased postpartum depression severity, as well as discussed, improved pelvic health. So, also interestingly, exercise does not negatively affect milk supply or fetal growth, infant growth, which is a concern for some women. But returning too quickly to exercise may increase the risk of pelvic floor dysfunction, bone stress injuries, persistent pain, long-term issues like osteoporosis. So you can see pelvic floor dysfunction, if you return too quickly, that can be something you increase your risk of, although it is recommended as well to keep working on pelvic floor muscles training. So it can be a bit confusing, but this gentle work on pelvic floor muscles is recommended, and it's more so not recommended to do very high intensity exercise right off the bat, as well as to avoid jumping movements. So with that, participation does decline postpartum, which in exercise, which is due to fatigue, lack of time, childcare, depression, and incontinence, and a lack of guidance. So it's really important for women to have clinician support, and because women who receive guidance from clinicians are much more likely to return to exercise safely. So what can we take away from this? Is that postpartum is a full body recalibration. There's reproductive involution, hormonal shifts, cardiovascular normalization, pelvic floor healing, and abdominal wall recovery. Layered on top of all of that, the lived experiences of pain, restriction, and resilience show how big a process postpartum really is. And these qualitative accounts that we discussed remind us that recovery is not simply biological, it's actually experienced. So understanding both the physiological and the lived experiences allow us to move away from this notion of bouncing back and towards a narrative of a more informed, compassionate recovery. Because postpartum healing, it's not linear, it's not the same for everybody, it's not uniform. It's a very complex process, and it's embodied, and it deserves better support. So thank you so much for listening, and we'll see you in the next episode.